Hello, welcome to this podcast, and we're going to talk about anatomy today in a life of medical student. So my name is Carolina, I'm a third year medical student. I've done Gateway prior to that, so this is my fourth year in medical school, and we're just going to talk about the importance of anatomy today and why do we do it in the first place. So hi guys, so would you like to introduce yourselves?
Hello. My name is Humam. I'm a third year medical student as well here at the Holyoke Medical School, and I love anatomy, so let's talk.
Hi, I'm Kat Sanders, and I'm a senior lecturer in clinical anatomy, and I also love anatomy.
We all love anatomy.
We all love anatomy. That's brilliant.
Common ground established.
So, guys, why do we do anatomy in the first place? What's the point?
So, for me, it's what I always say kind of at the start of students coming into anatomy from year one is, we like to boast in the anatomy department that it's the foundation of medicine.
Yeah.
And you're going to do loads of anatomy in your first couple of years, and we call it anatomy. But then later on, you're then applying that anatomy to other fields. So imaging, radiology, that's anatomy through a different view than what we have in the lab. Pathology is anatomy gone wrong, and the signs and symptoms are anatomy, and clinical examination is anatomy applied. So it's something that gets followed through all the way through medical school. It's just once we've got those basics nailed down with you, we start calling it for what it is once it's applied to a new field.
Definitely, because we stick to anatomy in the first 2 years. We do core anatomy just to kind of, once we're thrown into the clinical years, we know what we're talking about. And once quizzed by the surgeons, especially by the surgeons, we don't want to panic on the spot. And once Kat trained us to the core, we know what we're talking about.
Squeals from Kat before.
Yes.
No, I think anatomy is it's got a special place in your heart as a medical student, isn't it? It's like a special thing, it's a new thing. You can still remember the initiation ceremony where you got like a cadaver in the middle and induction, and you have all the medical students, and the cadaver was uncovered bit by bit. It's just it's got a special feel to it, and then as you learn anatomy, you kind of learn a new language in a sense. So I remember the very first few sessions were focusing on how to describe anatomy, how to describe the anatomical position, where are things in relation to each other. Exactly.
You guys might not know this, but supination, pronation, and adduction, abduction, flexion, it's ingrained. And they do ask you throughout in your clinical years, they do like to quiz you on those random little niche just to test your memory.
Yeah, and it's about that language making sense as well, and finding ways for it to make sense. So like Carolina was just then showing supination, which is the palms facing up, and we remember that as if you put your palms in front of you and cupped them, can I have some soup please? That's supination. And then the other way is pronation, like a pro basketball player bouncing the ball with the palm facing down, and these little tidbits that you use to remember it until you actually just know it straight off the bat.
100%. And as you said, when it comes to imaging and stuff like this, it is a basic language now. So when you're describing an image, or when you describe an X-ray, you're using all those terminology without even realizing. Because you might be doing that to a person on the phone who might not have access to the image. So through using those terminology, I think you wouldn't get too lost.
Speaking the same language as the other professionals you're working with.
Yeah, definitely. And it's really important to establish your basics, because without the basics, you can't progress further. And it feels tedious at the start because it feels like A-levels, because you go into lectures again, and but it does really help. And like her mum said, radiology. And it does link in throughout the entirety of medical school and further on. And
I'm pretty sure you had the same experience as well, but when you come as a first year medical student, you're not really knowing what's expected of you or how much you need to learn. It's just an ocean, isn't it, of things. You swim and you do some more swimming. And you don't know when to stop. But with anatomy, you look and you see all those big words. I remember first time I looked at the sternocleidomastoid, and it was quarter of the page, and I was what even is this? But then you learn it, you learn what it is, you learn how to say it and use it, and you feel so good, oh, I'm learning something. It's you feel that instant kind of reward of knowing things and seeing you progress throughout
Definitely.
what you know and what you don't. Yeah.
And that sternocleidomastoid muscle, as you said, like the importance of knowing that and what it is. It's a muscle in the neck, and you use it kind of as a landmark point to take the carotid pulse.
Exactly.
Like it's stuff that you use like day in, day out, where you might not be thinking, oh, I'm going to find the sternocleidomastoid and go for the pulse. You just know where to find the pulse because of that foundation.
Exactly, and because the way anatomy is taught within Holyoke Medical School, we have PBL and it's related. So it's not like you're going into anatomy and we're talking about the hip, and then you go into PBL and you're going to be talking about childbirth or something else, completely out of everything is related in its initial steps, so you will have the links and you will be able to be supported by teaching 100%. Staff.
Yeah, it is clinically focused, isn't it? We're not just going there to learn random words
for the sake of it.
Yeah, for the sake of it. So as you said, you'll be learning the physiology of the organ, how it actually works, and then you go to see anatomy and then learn the clinical things and clinical skills, or like how to use it and what landmarks to use as well.
Yeah. Because we do have pro sections in Holyoke Medical School, and why is the reason? Why do we have pro sections, not other things?
So pro sections, that word just means like professionally dissected. So it's something that's been pre-dissected. And for me, the reason why we don't teach by dissection is it's the opposite way of how you learn anatomy. So we kind of teach you the skeleton and the bones, and then we add on the ligaments and then the muscles and the nerves and the arteries and the organs. And if you're dissecting, you're going from the skin down to the bones. So you do it in like the opposite direction of the way you learn it. If we use that skeleton as like a foundation, you kind of need to see things as we've been showing you in the lectures, see them in the lab, move things around, think about how that then looks under the skin when you're doing clinical examination. So pro sections are a really quick way to get you to grips with that anatomy and seeing those core structures. I mean, there's lots of advocates for teaching by dissection, and we use it in the Masters in Clinical Anatomy programme. But the reason why people like to advocate for it is they say, oh, well, if you cut something once by mistake, you're never going to forget that structure. But if you've not learnt the anatomy beforehand, you're going to cut so many things you will forget what it is that you've gone through because you didn't have that foundation.
Exactly.
So those pro sections are really important. Like, how have you found?
I totally agree. I looked into this. So when I was applying to medical school, I was like, how does this medical school teach anatomy? And some medical schools, they said teach dissection, others pro section. And when, like, even now, like, I talk to some of my medical students, friends in other medical schools who do dissection. Like, you have limited time at the end of the day, and you're there to learn. You can only spend so much time actually getting to the structure. And then when you do get to it, as I said, if you cut the wrong thing or dissected wrong, then are you having a clear look of what artery supplies the organ or what vein supplies the organ? So I feel like when you're going there, I said, like, we're supplied with those pre-session worksheets that are quite handy, so have an idea about like what you're gonna be having a look at, and then you go in there, you're only focusing on something that looks how it's supposed to look, because as I said, like, it's
not
done by professional,
by other tissues.
And at the end of the day, if you want to go into dissection, you can intercalate in anatomy, and that is open. You've got the basics and you've got the foundations, and you can progress and you can intercalate and further develop your skills then.
And I feel that's the main kind of selling point for dissections. When I was looking at it, like seeing how organs relate to each other, or like where is this organ in relation to other structures, but I feel you do get that in pro sections, and that's also supplemented by complete anatomy that we get as well. So that's a digital kind of app where like you have access to the entire.
So we have both. We've got the pro sections, and we've got supplemented by the technology, and we cannot be more grateful to the silent donors. We do hold masses to celebrate their donations, and especially as a medical student, I could not be more thankful for those donations, because we do learn a great deal, and it's not the same with a book or with a model, because they're completely different, and you can see the variation between a person, every human.
It's like that beautiful privilege to see the differences between individuals, and I think that's so important as medical students, and doctors to be, is to appreciate the differences between each and every individual.
Definitely.
And that can go right down to the anatomy, which then in itself is something that you really need to be like clinically aware of, is knowing that sometimes things go in a different direction than the textbook says, or that the model has got it painted on. Absolutely. And as you said, we do have Thanksgiving ceremonies every few years to really acknowledge that gift and invite the families so that they can see what a huge gift their loved one's donation was.
I don't think I've been like to anatomy once without like between me and myself like thank you to those people. And like sometimes we do discuss as a group like you're actually gifting your body kind of strangers to learn, and there's like the good from within. It just like hugely appreciate it,
because that one donation is saving so many lives in the future, because we are going to become doctors in the end, we're going to become surgeons in the end, and the learning we gained from that is saving so many lives in the future. And it's just beautiful. It is beautiful.
It's a big gift.
It is. We are very privileged as a medical circle to have that, because obviously, like Ma'am, you've mentioned technology. We do have those VR kits further on in the clinical years. We have further models, but it's not the same. It's never going to be the same as a hands-on experience.
Yeah, it's not, because like now when we go into surgery and see how surgery is done, we're always comparing what we've seen in surgery to what we've seen in the lab.
Definitely.
The anatomy's getting applied.
100%.
And you do remember when Peter's coming around and quizzing you on different parts, and you just remember the shoulders, knees, and you remember those little aspects of anatomy that help you in those clinical years when the surgeons are grilling you on that.
And like also when, as Kat mentioned, we're doing like the clinical examination, like I felt an enlarged liver the other day, and it was like cool, but at the same time, if I hadn't felt a liver before, how would I know, or like how would I know where a liver is, like, or how does it feel like, or am I feeling liver,
what's
am I feeling
normal?
am I feeling something else? So it is extremely important,
because I don't know if you remember, we did have a liver which was completely abnormal in the anatomy session. And you were feeling it. I was like, this is not normal. This patient had something. And you step outside that lab and you think of so many different things, and then you experience a patient and you feel something abnormal, like you said, and you just know. You just know, don't you? Which is beautiful, because that we're all got that Sherlock Holmes mind now, and it just links in. It just links in, and you get in grabbing those experiences, and it just, once you get that puzzle complete, it's beautiful.
So Kat, you've done a great job.
You have, yes.
It's genuinely a team effort. I mean, we've got so many anatomists here at Hull York Medical School, so we all get to see you and see you develop. But like you say, you're coming into anatomy thinking, okay, I'm going to learn the anatomy, and by the time you're leaving that session, you're thinking, why was it like that, and what pathology might have caused that, and what impact would that have had on a person's life. And then you're going into those years where you're going out on placement, you're examining patients, and you're like, it's an enlarged liver, I know that, and that's that extra add-on of anatomy that you don't necessarily think about when you're going into the lab, but once you leave and years down the line you're applying it, that knowledge really coming to the fore. It's like an unconscious competence. Right. It's so ingrained that you don't have to think about the anatomy, because you just know it in the background.
Definitely.
And that's what you need.
Top tip from me for any aspiring medics or people who are going to start medical school: learn your anatomy from anatomy booklets. Those anatomy booklets were so useful. The night before, like literally have a look. And then, so when you're going to the lab, you're not really focusing on like, what is this? You're more focused, as you said, like grabbing one of the anatomists to ask a question, to look where the organ is in relation to other organs, and like learn more.
But you come out of it and you want to learn more. You do go back and you do look at the booklet. You want to learn more. You want to come back and you want to be prepared the next lesson. So he does teach you a lot.
And it's, I think, like coming into the anatomy lab is like the last thing you do, like each week in medicine. So you've had the lectures, you've had like the start of your PBL, so you kind of know the case that you're working on. You've then got the workbook that you're looking at. So by the time you're coming into the lab, you've learnt quite a bit of it already, and it's just that consolidation step and that working with the human tissue and with us and asking us questions, and more often than not us asking you questions, being really awkward like that. And then that nice kind of progression through the week to get you to that point where when you're actually in that lab, you know the stuff and you kind of know what you don't know yet and what you need to get out of it.
And then it consolidates everything for you before you go on placement and actually examine that organ or that system that you've been learning about.
Looking back on everything as a third year now, you see why it's there. You see why was the purpose of anatomy, why we had PBL in relation to this. It all makes sense retrospectively. In the moment, you're just getting on with it because you're just getting on with it. But it does have a massive impact on how we learn and why we're doing this. It's just, as a medical student, some things you have to get through, but as doing anatomy, it was 100% worth it, and it was definitely useful. Because
and it was the highlight of our week,
yes,
wasn't it?
definitely,
The night before anatomy was like, we have anatomy tomorrow. We were always excited to have anatomy and placement, because lectures, who's excited to go to lectures? No one.
The COVID kids, we had lectures online and we didn't know what it was like going into a lecture. And
by going lectures, to your kitchen to watch the...
Exactly.
And we are constantly evaluating the anatomy sessions and our teaching. There's stuff we're implementing this year, and we've got plans, 3-5 years down the track to be making it better and better. And it sounds like it's got a pretty good starting point. Really for you guys.
I do remember you guys were always flexible, kind of how would you like to be taught anatomy? Are there any things we can change? And you did actually change it for year 2, and something did change within the year as well. So it is very student focused in terms of how would you learn best, and
with how the team was very open to change, and how you guys recorded whilst we were in lockdown, the lectures and everything. And if we had honest feedback and we'd give it to you, you guys would reflect on it and you would change around it, and it felt like every student's point was valued. Definitely.
That's core to our practice, is making sure that students have that opportunity to learn the way they learn.
Exactly.
Because anatomy is so heavy that people need to find their own way of learning it and to get it to stick in their mind. So it's really important to us that everyone has those opportunities to make their own kind of curriculum out of the different learning resources and opportunities to get the most out of it.
And it's not like you're giving the support, they're giving the booklets. We can approach you. We can approach you and ask you questions. It's not like you guys sit in your office and just go away, don't touch us. Exactly. We can approach you, and the whole team and environment is so you could say comfortable and family-like, that you can approach you guys and can ask questions and can ask for the extra support. And that's throughout Hull York Medical School. I've never found myself being in a rut where I don't know what to do, because there's always someone I could approach, even if it's my friends within or just the team around, because there's always support there.
And the best thing is when you're so stuck and they come up with a trick to help you memorize something, and you go whoa.
Yes.
This makes so much sense.
It's just the alien drawings and different mnemonics, and you just remember it for the rest of your life. And there's always tricks and things to help you around everything.
One of the true joys as an educator is to just see that light bulb click behind the eye, be like, I can see that you've got it now. It makes sense to you now. And just to have those moments, try and strive for them every day that we are in there. Because to see also just the look of satisfaction and happiness, it makes sense.
And there are some things things in anatomy are named for a reason, and there's a structure kind of to be followed. And then when you get taught something, or you learn one way of how things are called or named, then you would apply it to other kind of structures to make educated guesses on what they might be called.
Or if someone, when you're out on clinical placement, says a word, that you've got enough of that language that if you don't quite remember it straight off the bat, I can work out what that is based on its name.
And in terms of how we approach anatomy in later years. We spoke about radiology. Is there anything that, and we spoke about quite a few clinical bits, is there anything that you've found specific in relation to anatomy, Hammam? Can you think of anything?
I think like other than obviously radiology and then the clinical examinations, you can imagine if you're like interested in going into surgery, anatomy is going to be your bread and butter, isn't it?
Of course.
So you have to have some basics and foundations going into it. Before, like if you're aspiring to become a surgeon, then a lot of people do intercalation as well, isn't it, where they take a year out and they do specialize in anatomy
in depth.
And we do support each other, don't we?
Yeah, 100%. Like loads of the time before or after anatomy is like, oh, I didn't quite get that, and then you'd have someone who's like, oh yeah, there's that trick to learn it, or remember it's next to this, or
at the end of the day, we are aspiring to be doctors, and you can be an aspiring surgeon, and in the back of your head you're thinking, okay, we're competing with each other, but it's not like that in medical school. We're here to help each other. We all want to be doctors, and there's all spaces to be those doctors, so it's not like there's only 2 places for 200 people.
Loads of people think that like you're in a competition and you're in that, but you're actually a team.
Yeah.
And in here we really support each other. I'm pretty sure like other medical schools would be similar culture as well. And we have a community going in here.
Yep.
I haven't found it like in many other courses to be like necessarily. We look after each other, we go socialise with each other
We do.
outside of learning as well. And we do actually like, I think, care for one another, and
we do
we do like look after each other, and it's important because our week is like pretty full on.
It is.
And it is nice, so please don't think that if you're gonna come to medical school you're gonna be alone or anything like this.
It is hard,
yeah,
but we get through it together. We do, and we get the support from not only each other, but we do get the support from staff members and Hull York Medical School as a school as well.
Weekly emails.
Support
and well-being.
And there's so many different opportunities outside just the learning. For example, you did do anatomy clubs outside and revision sessions outside, so it's a whole
anatomy soc as well, where like other students would be kind of doing some sessions to teach other students, and those were really useful.
A lot of our master's students on the clinical anatomy and education programs, they if they've integrated from HIMSS, they come back into their 4th year and they're straight to anatomy soc, and they're making videos and they're hosting revision sessions, because like they've done it in so much detail over that year as well. They can share that knowledge, because teaching is a fantastic way to learn as well. So it's like sharing those mnemonics with each other, no matter what year you're in, helping each other to remember it and then know it and then understand it. It is a team effort.
It is, and throughout, as you progress onto being those doctors or healthcare professionals, we do work as a team anyway. We do.
And teaching is a big part of being a medical student and also being a doctor, I think, isn't it?
Yeah.
Like,
we love the doctors that love to teach. Oh, we love them, because to find a doctor that is willing to teach and being good at teaching is really important for us as medical students. That's why getting yourself involved in those anatomy socs and helping each other teach anatomy, you're gaining those skills of teaching that you could progress on with in life and then teach medical students.
So when you're supporting each other, like not necessarily like teaching anatomy, like when you're supporting someone else explaining another topic, physiology, whatever, because as a doctor as well, if you think about it, if you're explaining a condition to a patient who's never heard the jargon words before or like heard those fancy anatomy words before, you have to explain things in a way that would make sense, that would help them make sense of their condition.
Exactly.
So I think being a bit of a teacher is a core competency.
And understanding what you're talking about as well. Yeah, definitely. Well, great. Thank you, guys. I hope you guys enjoyed this podcast today. And if you like to visit Hull York Medical School website for more information, just please to see other podcasts as well. I hope you get into the medical school and you find this really useful. Thank you, guys.
Bye.
Thanks. Bye.